So welcome everybody. This is Soul Science with Jacqueline Kane and Dr. Liz Lehman. And today I have the special honor of interviewing Sandra Gustafson, a Bowen practitioner, and she's been a healthcare professional for over 30 years, having studied and practiced nursing, naturopathic, and complementary modalities. Sandra blends her skills to offer her clients holistic healthcare services. At her office in Santa Rosa, California, she specializes in nutrition, herbal medicine, and Bowen work. Many clients seek out her services for relief from persistent pain and chronic health conditions that do not respond well to conventional medical treatments alone. Sandra also teaches Bowen work classes in the US and overseas. Welcome, Sandra.
Well, thank you, Jackie. It's such a pleasure to see you again.
Yes, it's been a long time.
Mm-hmm.
So Sandra, can you explain and share with people what it is you do and who you work with?
All right. Well, the last question is easiest. I'm an independent practitioner. I work as a holistic healthcare consultant in an integrative medical practice with other practitioners who specialize in acupuncture, osteopathic medicine, and naturopathic doctors, herbalists, nutritionists, and I bring to the organization my skills in my background as a nurse and having worked in medical settings for quite some time, and a background in herbal medicine, nutrition, and the bodywork technique that I provide for my clients is Bowen work, and it's a gentle bodywork technique that I had the fortune of learning in Australia 30 years ago, and it has served me very well as not only as a practitioner, but in being able to help my clients. And so I like to blend my skills in supporting my clients and in finding their optimal way forward from whatever their condition is that they are seeking support for. So I'm not necessarily treating anybody. I don't diagnose or treat anybody. The clients come to me and present their healthcare situation that's going on, whether they're under a medical care or they're just trying to navigate this on their own and find out what their choices are. And I try and meet them at that level and guide them through that process. And often it requires me to blend, understanding of the medical treatments, the medications they're on, the post-surgical or injury history, and understanding what they're really looking for, so that I can show them what their best choices are, whether it's sometimes a combination of working with both, or as some clients would like to have, just completely natural approaches. So I don't have a recipe for anybody. I just really am a facilitator in supporting my clients and helping them navigate through the healthcare choices that they may have.
Yeah, and navigating our healthcare system people need help in that. There's a lot to navigate through and to understand. Yeah.
Mm-hmm.
So can you share and explain Bowen, because it's still kind of new in the United States. I still get people who have never heard of it. The people who have are like, oh my God, you do Bowen, I love Bowen. But there's still people who don't know what it is.
Right. And the best way to explain it is to have somebody come and experience it. I'm still learning that after being a teacher all these years. It really is a soft tissue relaxation technique, and it's a fairly gentle and subtle technique compared to some of the more manipulative types of bodywork techniques that are available. It was developed by a man called Tom Bowen in Australia, and he worked with this technique that he developed fairly intuitively, without any formal training in his original way of learning how to work with the body. And he eventually came up with this system that he was able to apply for a lot of different types of conditions that people were presenting with, whether they were acute or chronic types of not just injuries or pain, but also general health conditions. So it it's a technique that is done with, manually, with the practitioner applying their hands to the person's body. The clients are usually clothed and are either lying on a table or maybe seated in a chair. And the practitioner is going to apply gentle, what we would call moves, which are stretching and gentle pressure on the soft tissue in very specific places, and making a move, it feels sort of like a rolling experience of the hands or the thumbs or the fingers over the soft tissue that sets up a very interesting reaction in the nervous system and the musculoskeletal system, in that it really resets the tension patterns that have been sitting in the tissues under the control of the nervous system, and facilitates a change in the tension in the tissues and the way that the nervous system is organized. So it's quite complex, even though it's a very subtle technique. And what it's really doing is creating a deep sense of relaxation throughout the whole body by relaxing the soft tissues at the sites where they're being worked on, but also within the nervous system. The whole nervous system is shifting into a more relaxed state while the person is receiving the work. And we notice this because people start to breathe a little deeper. Their bodies tend to relax on the table while we're working with them. You can actually feel some of the tension dissipate from the tissues at the site where the tension is. And people can feel what my clients call the healing feeling starting to happen, where things start to feel like there's a change happening, not just at the site where the client's hand or the practitioner's hands were, but throughout the whole body. And it feels very positive. It feels like something is shifting that's helping the body to support itself in its healing process. So I use this technique for people who have acute injuries or recovery from surgery or from some acute event. I also use it for clients who have a lot of pain as a persistent condition. And what I'm finding Bowen work does is it's really changing the brain's awareness of what pain is, as in giving it a chance to understand that it's possible to change that that sensation that seems to be permanent, or the person seems to not be able to get past that point. And it's because of the effect of the Bowen work moves. By stretching and gently applying pressure to the peripheral tissues, we're actually directly working with with not just the peripheral nervous system, but the central nervous system, and helping to alter that pattern that has been persisting as a sensation through the tissues, and in a way resetting that whole concept of this person's being in a state of pain. So it is difficult to explain that. That's a lot of physiology and neuroscience that I just kind of unwound on you right there. But the good news is that our neuroscience research is backing up everything that I just said. And we're learning this through all the new neuroscience of fascial anatomy, and understanding how our fascia and our nervous system are just completely intricately interwoven and inseparable, essentially. And that our way of understanding how pain has been managed and understood previously is starting to change, and even in the medical field too. We've been so affixed on pain as a sensation that goes from the periphery to the brain, and the way to manage that is block that sensation, and then you've managed pain. Well, what we've learned is that that's not how it works. So Bowen work has taught me that that we are um, intimately involved in changing the perception of pain, even without having a dialogue as such with the client, but we're having that dialogue with our hands as we're touching people and as we're communicating with their body, as we do with Bowen work moves. We are really sending new signals through the nervous system that's altering the brain's perception of the body's sense of self and where it has been and where it is now, after we are giving it these new signals through the nervous system that say change is possible. We can reset this. So that was a convoluted explanation of Bowen. As you said, it's not easy to explain it.
Well, thank you for all of that scientific background. So, because there are some people who need to hear that, because there is a science behind it. The other thing, the other part of the body I love, what it works with is the lymphatic system and how it really jumpstarts that lymphatic system. But before we go on to that, my clients are funny because the first time somebody has a Bowen session, they'll be like, because during the session, we actually step away from the body for a couple of minutes so that my energy is not interacting with the clients. Again, we are just facilitators. The body takes on the whole thing, the whole process, and decides what it's going to work on. And so in the first session, sometimes it takes people an adjustment to understand that. But the more moves you do and the more time goes by, they get really relaxed. And then people start to like it more than massage because they get more relaxed than massage, which is a beautiful thing. And that's when all of that healing that you just explained happens, because we're busy as human beings. We have a lot going on. So we're in our heads thinking, which can stop these amazing modalities from working when we're in our head so much. So the Bowen actually, once the client relaxes and allows all of that to happen, it is a true whole body, mind healing experience for some clients. It's truly amazing.
Yes, it really is. And I like that you mentioned the pauses, because I didn't spend much time on that. But if I was to describe Bowen work further, I'd say that it is, it's a soft tissue relaxation technique that facilitates the healing process. And that happens often when the practitioner has removed his or her hands from the person's body and allows the integration of the signals to really process throughout the whole nervous system and throughout the body. And we've learned so much about how our brains work in more recent years, in that the more time we can allow between incoming signals, the more meaningful the signals to our whole nervous system, brain being part of that, are. And what really fascinates me is that, Tom Bowen didn't have any formal neuroscience training that we know of. And yet, this is one of the most outstanding features of this technique, is that the practitioner does specific moves on a person's body, and then, as you say, steps out of the way, gives the person some space to not be stimulated, either by hands or verbally or orally through listening, and just really leaves the person in their own space for the whole person's system to process the effects of the work. And there is actually a very good book written by one of my colleague practitioners. Her name is Louise Tremblay, and it's about the osteopathic. She's an osteopath, and it's something that osteopaths have even have been working with. That is that the delay times or the pauses in between doing any sort of somatic stimulation actually enhances the effect of the work that has been done. And why this technique has the capacity to have more lasting effects, not just the relaxation, which is profoundly relaxing, but in my experience, having been a massage therapist prior to my Bowen work experience, I found the clients were getting better and staying better long after I had worked on them, compared to other techniques that I had learned. And this is because the body really, really responds in a very internal way. And it's not up to me, the practitioner, trying to fix or manipulate what's going on in the person.
Yeah. That's what really sold me on this Bowen therapy, because I went to my first class. Another massage therapist was like, "Hey, you want to go take this class on Bowen? Never heard of it. Sure, let's go." You know, you have to take credits. And before I went, as a massage therapist myself too, my thumbs were killing me because, you know, overuse. And it was always months of icing and massaging, which never helped. Started learning Bowen therapy months later. I totally forgot that my thumbs hurt me. Months later, I was like, my thumbs don't hurt. Oh my God. So every massage therapist needs to learn this technique, this modality, because it's powerful. And the
you can have a
clients,
career for 30 years like I have without injuring yourself, seriously.
and the pain hasn't come back. Yeah, it's been a long time for me too. And it's just amazing. I know we can't say all that we do, but oh my God, the results. People have been in pain for 17 years. The pain is gone. The body's more flexible. People sleep better.
Right.
And recently I've had clients with cancer and who've gone through chemo or radiation, which can impact their lymphatic system. And the Bowen really helps to bring back, to jumpstart their lymphatic system. It's amazing.
Yes, it really does. And I, you know, when I have observed this, it's just been really fascinating to me that the lymphatic system is so much tied to, well, it's intricately woven into the fabric of the fascia and the nervous system, and you just cannot separate the human body out, or anybody out anymore. I mean, I think our perspective of who living beings are these days has completely changed. We've finally come out of this mechanical view where you know, we can just reduce everybody to you are your nervous system, your muscle system, and your lymphatic system, and somehow they all work together, but it's really not the case. And I think this has really enriched and enhanced my capacity as a practitioner to understand that something like Bowen work, which is not just working with the muscles and the soft tissue and the nervous system, it is also working with the whole lymphatic system and all the functioning of our internal organs. And all of that is largely under the influence of a very large nervous system called the vagus nerve. And that's been my area of interest for quite some time now. And just the more I understand that, the more I'm able to really tune into that for my clients and center the focus of how I'm going to work with a client to try and facilitate optimal function of their vagus nerve system and their lymphatic system. And it has extremely powerful effects for clients. And I love that you've been able to see clients with lymphedema that has been unresolved for a long time because they've had lymph nodes removed for, you know, various types of cancer, are able to recover and regain some of the function in their limbs that were affected, and reduce the amount of lymphatic fluid that has been trapped in the tissues. And it does seem to sustain. And I learned lots of techniques and other bodywork techniques, and sure enough, it came back again. Or you have to be really careful that you could aggravate the problem, and it's never happened with Bowen work. It's so gentle and so subtle. It's very unlikely to cause any negative side effects, and we can offer a wonderful service to clients who have been through these experiences, because there's not that many other techniques out there that can help them this way.
Yeah. Yeah, it's really amazing how much it does for people. And my clients continue every day to just blow me away by,
Mm-hmm.
let's try this procedure, let's try that one. And
Mm-hmm.
it's amazing. It's really a gift.
Yeah.
Um, all right, so we answered so many of my questions. So you mentioned that you also do nutrition and all of that. So you've created a whole system to help people.
Yeah, and when I talk about nutrition, I mean that, and I meet the client where the client is willing to be at. And some clients are really well educated and are already taking care of themselves and understand how to eat a well balanced and healthy diet with that's rich in nutrients and taking care of themselves, without needing a lot of help. Whereas some clients actually need more specific guidance and information, sometimes coaching to help them change their choices and help them to find more helpful pathways. Some clients need nutritional support, as in supplements. I try and encourage people to eat healthy food first and then add the supplements if you need that. But sometimes you need like a boost of certain types of nutrients to try and facilitate a healing process or to reduce inflammation in the body and things like that. So I have I have the capacity to help people with that. And then I have a master's degree in herbal medicine, and really love bringing plants as medicine into the support for people. And so I can sometimes, depending where clients are at, I can custom blend herbal tinctures or encourage them to source their own herbal, resources and start making teas that they can incorporate in a daily basis, or bring foods into their diet that they might not have thought about. And so for example, now with winter coming, I like to encourage people to really start thinking about the immune system, and we've been doing that for the last year and a half with COVID.
Mhm.
Like there's a lot of things that people can be doing that become part of the natural way of eating, and not necessarily, oh, this is medicine and this is food, but bring in the mushrooms and the garlic and the ginger and all the good, nutrient rich food that gives your body the resources that it can use to repair and heal itself and stay strong and
Yeah.
resilient. Yeah, so it's for me, it comes quite easily because I've been doing it for so long, and it's something that I really love doing. There's nothing more fun for me than finding plants out in nature and you know finding ways to bring them into my, if not my diet, actually make something like herbal
Mm.
salves or teas or things like that with them. Hmm.
And actually, you bring up a good point, even water.
Oh,
Many
hydration.
clients, many
Oh.
clients, before they even start, when I start asking them how much water they drink, they're like, I don't drink a lot.
Mhm.
Wonder you have pain in your body.
And it's common, and and sometimes water just doesn't taste good for people, and
Mhm.
I get that. So what you can do, you can play with water, and hydration can be, like add some flavor herbs or some fruit juices, naturally squeezed fruit juice or something that doesn't overwhelm the water content, but just changes it so that it's pleasant. And sip on that all day long. That remember, most of your body is made of water, and you need water in order to, for every cell to function optimally. It has to be hydrated, and to be able to move, our tissues need hydration, and for our lymphatic system to be able to drain and remove the waste products, they need something to dissolve that the waste products into. So fluid is essential. So I get it when my clients say, "Go, oh, I hate drinking water." It's like, well, what flavors do you like? Are you into minty or fruity or sort of tangy things? Well, then let's see what you could put into that water that just brings it to a flavor that is
Mm.
palatable, and you don't think of yourself as drinking water.
Yes. And one other question I get about water is that, well, I drink carbonated water or I drink teas. Does that, can I add that to my water content?
Yeah, as long as it's not, really strong tea that has a lot of, like, if there's a lot of tannins in the teas, like black tea, for example, really rich in tannins, which is good. I mean, there's a lot of benefit in black and green teas and that. But if it's a very strong tea, it's actually going to create it's kind of concentrated. So you're in a way you're almost dehydrating yourself a little bit more than actually you will get the liquid, but you're also getting a strong concentration of plant uh, ingredients with that. So I would say just make it a little more dilute, it doesn't need to be, I mean, if you're trying to get the caffeine effect, well, then most people will do it for, the stronger tea. But I like black tea, but I usually just kind of dip my tea bag in there and just get the flavor of it and still feel like I'm having a cup of tea, but I know most of it is, water that's hydrating me.
Right, right.
Yeah.
Perfect. So any last words for people? Any last thing about Bowen or nutrition or anything that you'd
This is
like
what
to
I'd
share?
like to say. I think Bowen work is one of the most safe, non-pharmaceutical therapy that that clients can incorporate into their wellness and recovery care. Um, it's something that's very complementary to any other types of care that people may be receiving. I have worked with people who have been in acute cases of recovering from surgery,
Yeah.
and have actually helped people very close to the surgery dates, just to accelerate the healing response in the body, to really, to really muster up that capacity to heal. And it, people can do it in, as they're going through their normal medical treatment care. I mean, I don't like to schedule a bone work session on the same day that someone is having to have other treatments like physical therapy or anything else like that. But it can be done in a way that bone work can complement the recovery phase for people going through a recovery situation of, from an injury or surgery. It is very safe to use for long periods of time. You cannot overdose yourself on Bowen work. I've had clients that see me once a month, every month for almost 20 years now, and I'm part of their wellness program. And it's their self-care time, and they come in, and whatever's going on, I just offer them what they would like me to support them with. And it's like a tune-up, taking taking themselves in for service, basically, and tuning up. I've worked with people who've had very complex conditions and still do. I work with people who have major inflammatory conditions like fibromyalgia. I have clients who have systemic lupus erythematosus. I have clients who have chronic persistent pain, and on medications. They need conventional medicine as a support at this time in their lives, and also need Bowen work just to help them manage what they're going through. And most of my clients tell me that, if they didn't see me, they don't think they would get through a lot of what they have to cope with. And that's pretty amazing to hear them say that sometimes, because you just realize, like, wow, this is a very special place to be in this person's life, and to be that person who can offer them something that's really helping them find a way to manage a very complex condition. So I've been very privileged to be a healthcare practitioner, and I don't take it lightly, and I'm very grateful that I learned this technique, and it's been able to support me in my career, but also help me be a practitioner that can be of value to so many people in my community. All right. I think I lost you for a moment, but I think we're back.
Sorry about that, some technical difficulties.
Yeah.
Well, thank you for all of this information. And how can people get a hold of you?
Probably the easiest is to look up my name, Sandra Gustafson, and Bowen Work. It will lead you to my website, which is Bowen Work for Life. And there you can read all about me and you'll find all my contact information. That's the one way. The other way is through the American Bowen Academy. And if you would look for Find a Practitioner, I'm in California, and if you look through the California Practitioner referral list, you'll find me there too. So yeah, and I welcome any inquiries, or anybody like some more information about Bowen Work or what I offer. I'd be happy to help people with that.
Wonderful.
Yeah.
Thank you so much for being here today, Sandra. And if you have any questions, absolutely reach out to Sandra or myself, and definitely check out the Bowen website. So much great information, and it's really an amazing technology and modality. So thank you again. This is Jacqueline Kane from Soul Science, your no BS dose of mind-body healing, health, and wellness. Thank you.
Thanks, Jacqueline.